Climbing or descending stairs might seem like a simple everyday action, but it's actually one of the most demanding activities for your knees. It puts immense stress on your knee joint, highlighting any underlying issues. Let's break down the mechanics. Increased load. When you climb stairs, your knee joint bears a load equivalent to 3 to 4 times your body weight. Going downstairs can be even more demanding, sometimes up to 5 to 6 times your body weight, as your muscles work harder to control the descent. This is far more stress than walking on a flat surface. Complex motion. The knee undergoes a complex bending and straightening motion combined with rotation as your body weight shifts. This requires precise coordination between muscles, ligaments, and cartilage. Key structures involved: cartilage, menisci and articular cartilage. Smooth, slippery tissues that cushion and absorb shock between bones. Ligaments, strong bands that connect bones and provide stability. Tendons, connect muscles to bones. Patella, the kneecap, slides in a groove at the end of the thigh bone, femur. Muscles, quadriceps, front thigh, hamstrings, back thigh, glutes, buttocks, all essential for power and control. When any of these components are compromised, whether by weakness, inflammation, or structural damage, the high demands of stair climbing expose the vulnerability, resulting in pain. Ignoring this pain isn't just accepting discomfort, it's overlooking a critical signal that your knee mechanics are under strain. Understanding this daily challenge is the first step to identifying the root cause of your pain. That specific pain when climbing or descending stairs is a direct indicator that something is amiss within your knee joint. It's not just getting old, it's often a sign of specific, identifiable conditions. Let's delve into the most common culprits. 1. Patellofemoral pain syndrome, also known as runner's knee. What it is: pain around or behind the kneecap, patella. The patella doesn't track smoothly in its groove on the thigh bone, femur, during knee bending. This causes friction and irritation. Why it hurts on stairs? The forces on the patella are significantly increased during stair climbing. Weak quadriceps, especially the inner quad muscle, vastus medialis obliquus, tight hamstrings, tight IT band, or flat feet can all contribute to poor patellar tracking. Common symptoms: dull ache behind the kneecap, pain worse with stairs, squatting, or prolonged sitting. 2. Osteoarthritis, or OA of the knee. The most common form of arthritis, where the protective cartilage that cushions the ends of your bones wears down over time. Without smooth cartilage, bones rub against each other, causing pain, stiffness, and inflammation. Why it hurts on stairs? The increased load and repetitive bending on stairs exacerbate pain in worn-down joints. The grinding sensation often reported is due to cartilage loss. Common symptoms: pain that worsens with activity, stiffness after rest, swelling, loss of flexibility, grating sensation. 3. Quadriceps weakness. What it is: weakness in the large muscles at the front of your thigh, quadriceps. These muscles are crucial for extending your knee and controlling its movement. Why it hurts on stairs? Your quads work extremely hard to lift your body upstairs and to control your descent downstairs. If they are weak, other structures like the kneecap or meniscus take on excessive load, leading to pain. It also impairs your ability to stabilize the knee effectively. Common symptoms: feeling of instability, buckling knee, increased effort, and pain with stair climbing. 4. Meniscus tear. What it is: the menisci are C-shaped pieces of cartilage that act as shock absorbers between your shin bone and thigh bone. A tear can occur due to twisting injuries or simply degenerate with age. Why it hurts on stairs? The twisting and bending motion of stairs can pinch or aggravate a torn meniscus, leading to sharp pain, clicking, popping, or a feeling of the knee giving out. Common symptoms: pain, swelling, popping or clicking, knee giving way, difficulty fully straightening the knee. 5. Bursitis. What it is: inflammation of the bursa, small fluid-filled sacs that cushion tendons, muscles, and bones around the knee. Why it hurts on stairs? Repetitive friction and pressure on the inflamed bursa during bending and weight-bearing can cause pain. Common symptoms: localized pain, tenderness, swelling, warmth. 6. Tendinopathy, e.g. patellar tendinopathy or jumper's knee. What it is: degeneration or inflammation of a tendon, commonly the patellar tendon connecting kneecap to shin bone, or quadriceps tendon. Why it hurts on stairs? Stair climbing places high tensile stress on these tendons. If they are compromised, pain arises. Common symptoms: localized pain just below patellar or above the kneecap, quadriceps, pain with activity and direct pressure. 7. Other factors. IT band syndrome. Tightness in the IT band, a tough band of tissue on the outside of the thigh, can cause pain on the outside of the knee. Referred pain. Sometimes pain from the hip or lower back can be referred to the knee. Understanding these specific causes is crucial. Your knee pain on stairs isn't just random. It's a diagnostic clue pointing to a treatable issue within the complex mechanics of your knee joint. Ignoring persistent knee pain, especially when it limits everyday activities like climbing stairs, isn't just about discomfort. It's a silent gamble with your mobility, independence, and overall health. Knee pain, if left unaddressed, rarely gets better on its own and often progresses to more serious, debilitating issues. Here's what happens when knee pain on stairs is ignored: accelerated cartilage damage and worsening osteoarthritis. The cycle. Pain on stairs indicates cartilage issues. Continuing to stress an already compromised joint without intervention accelerates the wear and tear. More cartilage loss means more bone-on-bone friction. Progression. What might start as mild OA can rapidly progress to severe, debilitating osteoarthritis, making even flat-surface walking difficult. 2. Increased pain and stiffness. The itinerant pain becomes constant. Stiffness sets in, especially after periods of rest, making it harder to get moving. Reduced range of motion. The knee joint can lose its ability to fully bend or straighten, severely impacting daily activities. 3. Functional limitation and loss of independence. Everyday impact. Tasks like getting in and out of the car, standing from a chair, walking on uneven surfaces, or even navigating your own home become difficult or impossible. Reliance on aids. You might become dependent on canes, walkers, or even wheelchairs, losing cherished independence. Social isolation. Inability to participate in social events, hobbies, or travel leads to withdrawal and loneliness. 4. Muscle atrophy and imbalance. Disuse weakness, avoiding stair climbing or other painful activities leads to disuse and weakening of crucial muscles, particularly the quadriceps and glutes. The vicious cycle. Weak muscles provide less support for the knee, increasing pain, which in turn leads to less activity and further muscle loss. This imbalance exacerbates joint instability. 5. Increased risk of falls. Unstable knee. A painful, weak, or unstable knee is a major fall risk factor. Pain can cause you to shift weight awkwardly. Fear of falling, paradoxically, often leads to reduced activity, which further weakens muscles and balance, increasing the actual risk of a fall and its associated injuries like a hip fracture. 6. Impact on overall health. Sedentary lifestyle. Chronic knee pain can force a sedentary lifestyle, which independently increases the risk of obesity, heart disease, diabetes, and other chronic conditions. Weight gain, combined with reduced activity and increased pain, can lead to weight gain, which puts even more stress on the already damaged knee. Mental health. Living with chronic pain and limited mobility often leads to anxiety, depression, and reduced quality of life. The progression of knee pain from a minor nuisance to a debilitating problem is a stark reminder that early diagnosis and proactive management are not just about relieving discomfort, they are about preserving your mobility, independence, and overall quality of life. Don't wait for your knee pain to dictate your future.
The good news is that most knee pain, especially that related to stair climbing, can be effectively managed with non-surgical approaches. Taking action early can alleviate pain, restore function, and prevent progression to more severe stages. 1. Seeking diagnosis. What to expect at the doctor's office. Don't self-diagnose. Schedule an appointment with your primary care physician or an orthopedic specialist. Be detailed about your pain, when it occurs, upstairs, downstairs, at rest, its nature, sharp, dull, grinding, and what makes it better or worse. Your doctor will likely 1. Thorough medical history and symptom review. Discuss your pain patterns, activity levels, and any relevant past injuries. 2. Physical exam. Assess range of motion, stability, tenderness, and muscle strength. They may perform specific tests to check for meniscal tears or patellar tracking issues. 3. Imaging if needed. X-rays to visualize bone structure, joint space narrowing, and bone spurs, common in OA. They do not show cartilage or soft tissue. MRI, magnetic resonance imaging, provides detailed images of soft tissues like cartilage, meniscus, ligaments, and tendons, often used if a meniscus tear or severe soft tissue injury is suspected. 2. Non-surgical treatment options, your primary approach. These are the cornerstones of managing knee pain on stairs. A. Physical therapy, PT. This is often the most critical non-surgical intervention. A physical therapist will 1. Assess. Identify specific muscle imbalances, weakness, especially quads and glutes, gait issues, and joint mechanics. They may perform specific tests to check for meniscal tears or patellar tracking issues. 2. Strengthening exercises. Focus on quadriceps, especially VMO, hamstrings, glutes, and core muscles to improve knee stability and reduce load on the joint. 3. Flexibility and stretching. Address tightness in hamstrings, quads, and IT band. 4. Balance training. Improve proprioception and stability. 5. Gait retraining. Learn proper mechanics for walking and stair climbing to reduce stress. 6. Pain management modalities. Ice, heat, ultrasound, or electrical stimulation. B. Lifestyle modifications. Weight management. Losing even a small amount of weight significantly reduces the load on your knee joints. Every pound of body weight equates to 3 to 6 pounds of pressure on the knee. 2. Activity modification. Temporarily avoid activities that severely aggravate pain. Gradually reintroduce them as strength improves. Use ramps or elevators when available, but don't stop moving entirely. 3. Proper footwear. Wear supportive, cushioned shoes with good arch support. Avoid high heels or worn-out shoes. C. Medications and supplements. Over-the-counter OTC pain relievers, NSAIDs, ibuprofen, naproxen, or acetaminophen can help manage pain and inflammation. Use cautiously and as directed. Topical pain relievers, creams or patches applied directly to the skin. Supplements. Glucosamine and chondroitin are sometimes used for OA, but evidence is mixed. Turmeric or omega-3s may help with inflammation. Always discuss with your doctor. D. Injections. Corticosteroid injections can provide temporary pain relief by reducing inflammation directly in the joint, not a long-term solution. E. Assistive devices. Braces or taping can provide support for the kneecap or stabilize the joint. E. Canes or walkers, if necessary for short-term pain relief or long-term safety, especially during acute flare-ups. Taking action means being proactive, diligent, and collaborating closely with your healthcare team. Non-surgical approaches are incredibly effective for most, offering a pathway to significant pain relief and restored function. Managing knee pain on stairs isn't just about temporary relief. It's about a lifelong commitment to knee health that preserves your mobility, independence, and the ability to enjoy an active life. It's about moving from reacting to pain to proactively nurturing your joints. 1. Consistent exercise as a pillar. Lifelong strength. Continue a consistent program focusing on quadriceps, hamstrings, and glutes. Strong muscles are the best shock absorbers and stabilizers for your knees. Balance and flexibility. Regular balance exercises, like single-leg stands or Tai Chi, maintain joint range of motion and prevent stiffness. Low-impact aerobics, swimming, cycling, elliptical are excellent for cardiovascular health without excessive knee impact. Stair training, gradual. Once pain-free, gradually incorporate stair climbing into your routine. Start with short flights, use handrails, and focus on proper technique, leading with the stronger leg up, weaker leg down initially. 2. Maintain a healthy weight. Reduce load. Every pound of body weight lost reduces significant pressure on your knees. This is one of the most powerful long-term strategies for joint preservation. Sustainable habits. Combine a balanced diet with regular exercise for consistent weight management. 3. Optimize your nutrition for joint health. Anti-inflammatory diet. Emphasize fruits, vegetables, lean proteins, and healthy fats, like omega-3s from fatty fish, nuts, and seeds. Limit processed foods, sugar, and unhealthy fats that fuel inflammation. Vitamin D and calcium are essential for bone health, which provides a strong foundation for joints. 4. Adequate protein, essential for muscle repair and maintenance. 4. Listen to your body, proactive pain management. Don't ignore new or worsening pain. It's a signal. Address it promptly. Ice or heat, as needed after activity to manage minor aches. Avoid overexertion. Know your limits and don't push through sharp pain. Gradually increase activity. 5. Smart footwear and foot health. Supportive shoes. Continually wear good quality supportive shoes with proper cushioning and arch support. Replace worn-out shoes promptly. 6. Podiatrist visits. If you have chronic foot problems, see a podiatrist. Foot mechanics directly impact knee alignment. 7. Ergonomics and body mechanics. Proper lifting. Bend at your knees and hips, not your back when lifting. Sitting posture. Avoid prolonged sitting in positions that strain your knees. Stair technique reinforcement. Continue using good form on stairs, leading with strong leg up, good handrail use. And regular professional checkups. Continue annual visits with your doctor or physical therapist for ongoing assessment of your knee health, muscle strength, and balance. They can help fine-tune your long-term strategy. Building lifelong knee health is an ongoing commitment, but the reward is immeasurable. The freedom to move without pain, to participate in the activities you love, and to maintain your cherished independence for years to come. Your knees are built to last, but they need your consistent care. That hesitation at the bottom of the stairs, that sharp twinge in your knee, it's easy to dismiss it as just wear and tear. But today, you've learned a critical truth. Knee pain on stairs is a powerful signal, often pointing to specific, treatable issues within your joint. Ignoring it is a gamble with your mobility and independence. You now possess powerful knowledge. The immense load stairs put on your knees, and the complex mechanics involved. The root causes of knee pain on stairs, from patellofemoral pain and osteoarthritis to muscle weakness and meniscus issues. The dangerous progression of untreated knee pain, leading to accelerated damage, loss of function, and increased fall risk. the importance of early diagnosis, and the wide array of effective non-surgical treatment options, led by physical therapy, and the lifelong strategies for building robust knee health, consistent exercise, healthy weight, optimized nutrition, and diligent self-care. This isn't about living in fear of stairs, it's about informed empowerment. It's about transforming passive acceptance of pain into proactive pursuit of pain-free movement. Your knees are designed for movement. Empower them. So, here's your crucial call to action. If you experience knee pain climbing stairs, talk to your doctor or a physical therapist today. Get an accurate diagnosis. Commit to a targeted exercise program to strengthen your quadriceps, hamstrings, and glutes and improve your balance. Consider weight management if you are overweight. Even a small loss makes a big difference. Review your footwear and ensure it's supportive and appropriate. Don't wait for the pain to worsen. Early intervention means simpler, less invasive solutions. And most importantly, share this message. This knowledge can be life-changing. Talk to your family, your friends, anyone who struggles with knee pain on stairs, because empowering someone to understand their pain can lead to a healthier, more mobile, and more independent future, reclaiming every step of their lives.